طلع الطاولة شوية هذيلي وكهو طلع الطاولة ويجاني شوية لينا. So the case today is a 36 years old woman. She was شنو ها الحق توك نمشي هكا شو تسكر هكا سي بون هكا اي هذيلي سي بون طلعتها. اطلع لي لفوق شوية ترى لا بلوتو اهبط لوطة شوية اهبط لوطة شوية اهبط سكوبي لوطة شوية باهي باهي عارف. So 36 years old woman. This is the third session of ERCP. She get laparoscopic cholecystectomy, I think, 8 months ago, complicated with biliary leak and jaundice. The first ERCP done in August, I think. We found a stricture regarding the cystic duct. It was difficult to access to the upper CBD, but we reached with a guide wire. We make dilation, and then we proceed with two plastic stents, 10 French. We get the second session 4 months ago. We placed 3 stents, as we see on the cholangiography screen now. اطلع لفوق شوية هذه اللي خلينا نحطه. We see the 3 stents now. So the purpose today اخرج لك انت شوية. C'est bon. So we see the third stent, 3 stents above the metallic clips of the laparoscopic cholecystectomy. So we proceed to our ERCP now. This is a T-tube, so usually we push our scope and turn to the right a little bit and then push, and we see the scope going along the esophagus wall. This is our cardia. We are in the stomach. We'll suck all this bile. So we will try to divide our procedure today in steps. So the first step, of course, we have to accede to our duodenum, second duodenum. This is the first duodenum. We'll push a little bit. We will turn the little wheel to the right and lock it. And now I will pull back to get the sharp scope position. And this is my 3 stents. So first step, acceding the papilla. Second step, we have to extract our stent. So we have 2 10 French and 1 7 French. I will begin with a snare to extract through the channel the 7 French stent. So sometimes we are advised to put our first guide wire inside, but in this case I don't think it's really mandatory because we have just the path created with a 3 stent. I'll show you. So I will try to catch my first stent here, this little one. We see the upper one, and I want just to take the tip of the stent. هبدأ سكتها 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 c'est bon ما تقويش برشا. So I will put it through the channel. It's a 7 French stent, and he's coming slowly. I don't think I will be able to do the same thing with the 10 French, but we'll try. So first one extracted. Okay. So usually for the 10 French, we take out the scope out only if I can really catch the distal part. So I will try to catch the distal part of the stent. حل حل. So I will take it from above and try. It's not always easy, but we have to take our time to change our scope position. Sucker, sucker, sucker. So I will try to change my stand position to put it just حله. حل 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 حل. حل على الآخر حل حل. سكر ترى. سكر سكر. So I can't get it out from the channel like this because maybe it will be locked in the. So I will try to extract a little bit to move it. حل سكر 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 سكر. So I will don't waste a lot of time. I will take it out from the mouth. So the stent is coming. So I think we have to do it twice for the other stent. Hello. سكر. So we are inside again. هذي لي شوية زيلو بربي حط لي زيلو. We put some gel on the scope. I have some resistance here. C'est bon. Now it's easy. I will exfoliate a little bit my stomach and go again. This is our duodenum. This is the antrum, and this is the pylorus is there. So the same, I will lock my little wheel, right, and try to pull back. I'm not still inside. I will go again, and this is our second duodenum. So pull back our scope, and this is the short scope position. So we'll try to catch. I think it will be. تصوير. So just we set up the cam. So we are again. So I will try to take the tip of the snare, the stand. حل شوية. حل. So if I can get the distal سكر شوية. سكر. So this is the perfect way. I will try to just have the stand in the channel, and we see it coming slowly. So we have just to bring it back slowly until we feel it in the distal part. I will take out my cap. And this is the last stand done. So now, first step done, the extraction of our 3 stents. So I will proceed with the access of the papilla. I have the choice. سكوبي بربي تطلع لفوق شوية. So we make it really easy step by step today. We can use directly our extraction balloon to clear the biliary duct, but I will proceed as usual with the sphincterotomy, access our CBD, and then exchange with our extraction balloon. So this is the sphincterotomy. So our wire is going up, up, up. I will help with access. We are in the upper part, so we are okay. So I won't inject any contrast now. I will just leave my wire there and exchange with an extraction balloon. So I want to get an occlusion cholangiogram before doing anything. So if we follow guidelines, we have to exchange the stent today, but I will do the occlusion cholangiogram to see the CBD and what was done with the previous 2 sessions. So we'll switch for the fluoroscopic view. We see some sludge coming. So this is due to the plastic stent. We saw in the one of the 10 French some little stones. This is a sign of the beginning of obstruction of our stent. Purge. So we are going inside. I have to go in the upper part. We cross it easily the structure. So we inflate to 12 millimeter balloon and we'll inject some contrast. And this is the intrahepatic bile duct. We see the left, the right, and we cross it now the structure with a 12 millimeter balloon, and we cross it easily. So I don't think we will need. We see our تعمل لي rotation سكوبي بربي. We rotate our fluoroscopic tower to see. Stop. في الجيد نتاعك هذا. زيد. So we see really dilation of our structure. We don't have any structure yet. Inject it. So we see really clearly it's تعمل لي inclinaison هكا. Stop. باهي. اطلع لفوق شوية ترى. هكاكا سي بون. باهي. خلينا نزيد نطلع هنا توا. So I will try to go to the upper part. فش لي شوية فش ترى. فش. انفخ هاي، انفخ كله، انجكت. So we see clearly I don't have any stricture now, and I think my balloon will cross easily. This is a 12 millimeter balloon, and it's not blocked there because we have the biliary bifurcation at this level. فش شوية ترى، فش الكل، فش. So I will cross my stricture easily now. We are in the upper part. انفخ لي ترى، نبغي نتسكر الغبينة، نقول لك. So I will come bring back slowly my balloon, and we see at the level of the clips we can cross it easily. For sure. So the question now is, should we put more stent or not? I think I'm not really convicted to putting other stent. عضو فخذتها كلها. So our 12 millimeter balloon is crossing easily our stricture. رئيست بسكوبي درست لي ما بالعكس. ارجع لي لين ترى وقت هيك وقف مغادية. باهي اهبط لوطة شوية، يجيني لينة كومبليتمون ترى. خذ كونتراست، خذ وخر ليك انت شوية ترى، اقعد هكاكا، زيد وخر شوية، زيد ترى، انجكت انت. ستوب ستوب. باهي. So we will leave our wire there. فش هذاك البالون قداش ديلاتاسيون؟ 10. واي باهي. فش طلع في الفيدز. So just to check if we are really without any stricture, I will insert a 10 millimeter dilation balloon and inflate without pressure and see if we can reach the 10 millimeter easy without any difficulty. لا طيب اجعل دخل دخل. لا تنحي الدور اللي غادي نحي، حلو حلو. سايب سايب. اعطيها كومبريس، تشد تطلق هذه، اعطيها كومبريس. امشي امشي يا مطلوق، حط امشي زيد. برد الزف. كيف يوصل قولها غادي. نمشي. اش بدا؟ فاش لي خذ سرانك دو فان ولا دو؟ اش بدا؟ سي بون. عاوني على الفيديو. سكوبي تهبط لي اللوطه هذه شويه، خلينا نشوفوا الدينوسكوب اللوطه. سجلت شويه تصور. So the balloon is coming, so I don't want to hurt my balloon with the elevator, so I will push slowly في الجيد نهت. And if we feel resistance, it's about the wire in the upper part of the lever that we see locked there في الجيد نهت. لأن في الجيد واش قاعد يخرج لها. So the balloon now has crossed. So what we will do now, I contrast. يز باش تسبيلي قبل نحيي له واسع. برا. So we will just inject contrast in the balloon. تحس ريزيستانس قول لي. So we see the balloon inflated now. دقيقة شوية نهد. برا اطلع. So I don't see any sign of compression. We are just putting some contrast without pressure in the balloon. أعطيه جا. سكر الغبين. So I will go until 10 millimeter. I will pull back slowly just my balloon. برا. So this is the 10 millimeter dilation balloon. So I think it's okay. I have the fish. فش بشوية. I will pull back my 10 millimeter and راح انفخ شوية، اطلع شوية. اطلع للسانك اطلع. سي بون. قديش تو؟ كان عندك مشكلة في الغوبيني طابت سيء. قديش بريسيون؟ البرودوي من يدك جاي نهاية غادية. يدك بالبرودوي. اي دونك. اي نحيها. حط طول حط. اطلع للتخوات اطلع. نهد بحر، شوف قاعد يضيع ولا من غادي. اقعد هكاك ادخل اقعد. So I'm at 8 millimeter now and we see the dilation balloon في الجيد يا نهد. Is crossing easily. اجد في الجيد نتاعك يا نهد. We see the balloon is going easily through our structure. We are at 8 millimeter now. Witness this هذا. راح اطلع لل5. وين الورقة نتاعو؟ اطلع للسي 6. So now we are at 10 millimeter and it's moving easily. So really I fish. So I won't do any stent now. قول لهم يجيو يهزوا هاي. ليش الكل تاني ليش بدا؟ دز بتاعك دز. امشي امشي امشي. So next step, last one, we will just go with the extraction balloon and try to clean maybe the upper part of our CBD if there is something there. And I won't put any stent today. Ballon. So this is our extraction balloon, 12 millimeter, and it crossed easily the stricture. We are in the upper part now, and he come out. So we'll go again. This is the right hepatic duct. So we will leave now. It looks okay. So the next step, we will, she maybe will leave today, and we will just check the stricture with just liver test. The next test will be done after 2 months for 1 year, I think, and then we will check once a year. Of course, she will leave with antibiotics for 2 days. أعطيها لي بروتيز أنا كيف أحطهم لها.